Hello and welcome to the Trust Driven Podcast. I'd like to introduce our guests on the podcast today. First, this week we got Dr. Josh Satterlee, a chiropractic expert in Las Vegas, Nevada. Maria Naidig, a registered nurse and patient advocate in Columbus, Georgia. Dr. Dwayne Golbeck, a chiropractor in Catoosa, Oklahoma. And Dr. Lauren Bietek, a chiropractor in Lake in the Hills, Illinois. All right, question number 1. The article is titled Perioperative Digital Behavior Change Interventions for Reducing Alcohol Consumption, Improving Dietary Intake, Increasing Physical Activity, and Smoking Cessation, a Scoping Review. This one was written by Katarina Asberg in the Journal of Perioperative Medicine out of London in 2021. Your question is, digital behavior change interventions are defined as interventions that employ computer technology to encourage and support behavior change with a goal of preserving or maintaining health, improving or maintaining health, or decreasing or maintaining health. So we are looking here for A, preserving, B, improving, or C, decreasing. So we're looking at what the goal is of digital behavior change interventions.
Do we hold up our answers?
Josh, Josh, don't cheat.
Oh.
You got to wait for your minute to be up.
Oh, my bad. You can tell this is out of London because they do behavior with the O-U-R at the end, like Calour and all those nice ways to spell words that they add the letters in. That's a very British thing.
Or traditional.
Yeah.
This study they used, just to kind of give you guys a little backstory while you're thinking of your answer, they used text messages and games, actually, to help kind of see if it'll change people. So it's kind of about obesity, smoking cessation, alcohol. Yeah, just kind of interesting. Different platforms, not just text messaging that I feel like most digital input is.
It says perioperative too, and I know that that's always a struggle, is like certain surgeons won't do procedures until the person is like stopped smoking, and so you have this delay before surgery, and it can be motivating or frustrating, I'm sure, to the patient.
Your time is up. Sorry to cut you off, Josh. Okay, Josh got B, Dwayne's got B, Lauren's got B, and Maria's got B. Nice job, everybody. Let's see what your answer was. It was B. So to read that question like in its entirety would be, digital behavior change interventions are defined as interventions that employ computer technology to encourage and support behavior change with the goal of improving or maintaining health. Pretty cool. Yes, they did find out that it actually helps with physical activity and the alcohol cessation, but they really didn't find much positive in smoking cessation. So it's not, they're still trying to find what the best media would be to help.
That's interesting.
I could say where with the advocacy part, like Melanie, you were saying about the text messaging. I mean, I know I just had a patient the other day telling me, he's getting things done quicker than he normally would. He's pushing himself a little bit more because he knows that we have these follow-up calls. And so when you said, because I'm like, digital behavior change, what in my head, I'm like, what kind of digital behavior change? Okay, this is something obviously internet related, which we seem to be going toward. But when you said the text messaging, I was like, oh, it definitely, that's what gave it away for me, because I mean, with the advocacy, it's just having someone, it's almost like having that accountability to know that someone is tracking what you're doing. And it's just like a reminder of, hey, you need to do this in order for this to happen too.
Mm-hmm. Yeah. And that's why I thought this research was kind of cool, because there was a game also. So they did text messages, and then a different part of the study was a video game. I'm like, oh, that's kind of cool. But yeah, a lot of these questions have to do with the whole including the internet into patient care, because we use it so often. So we're on our phones so much more. So there's a lot more research coming out about electronic health. All right. Well, nice job, everybody. Everybody gets points there. Let's move on to question 2. So the title of this article is Patient Satisfaction with Physician-Patient Communication During Telemedicine. This was written by Zia Agha in the Telemed and Electronic Health Journal in 2009. So your question here is, physician-patient communication during telemedicine was blank to communication during in-person consultants. So is it inferior to communication during in-person consultants, or not inferior to communication during in-person consultants or consultations, excuse me. Yeah, so what do you guys think? That telemedicine is inferior to the communication during like an in-person meeting, or would you say it's not inferior?
It's interesting to me that it's not asking about patient satisfaction during telemedicine, just is the communication itself inferior or not inferior?
Mm-hmm.
Or is it not inferior, which would make A correct then? You know, that's how you got to think about it.
It depends on what the patient is wanting. I mean, if this is something that they need to be seen in person for, or if this is something that's ongoing and it's with their provider. I mean, I feel like this could go either way, like Dr. Josh was saying.
Yeah. Yeah, like mental health treatments, for example, like telemed has got to be really close to in person without all the inconvenience of driving. But like as a chiropractor, like very few of my treatments are as effective over telemed as in person.
All right, that's time. This is in the primary care setting. So that, I mean, yeah, the bunch of us here that are chiropractors, it would be pretty difficult to be manipulating via telemedicine.
Mm-hmm.
All right, Josh got A. I see Maria's got B. Lauren, I can't see her.
That's an A.
A. And Dwayne's got B.
We split the room.
Look at that. Let's see. You guys had a 50-50 shot. So it was found by the 221 participants that they were equally satisfied with the physician's ability to like develop rapport and decision making and having a patient-centered communication during telemedicine, just as much as it was in an in-person consultation.
Interesting.
Dwayne.
Yes, I think this is interesting because when I think of telemedicine now, I think of more like cutting edge, right? So I would think it would be better because a lot of the like old school guys who aren't going to adopt the new things are probably not going to be caring as much about communication. Whereas younger docs, it's like we know that Instagram and Snapchat and everything is where most of our patients are going to be living. So we know that part really matters, and being on the internet matters for that. I think that's interesting.
Lauren, you do quite a bit online, right?
Yeah, for the nutrition coaching and like weight loss coaching portion. I feel like that one's a good one to do online, but you know, like you said, with the chiropractic and physical therapy, like obviously that's not gonna work as well online. But
you know, what'd be super interesting would be like a study where they do a very physical type of medicine, like chiropractic, like hands-on care, but then the study was based on if you do like a 10-minute telemed just visit where like you can't do any of the hands-on stuff, but just build a relationship, just build rapport, and then, or is it better to add that 10 or 15 minutes onto the actual patient visit when they come in your office?
So like the history and stuff. I mean, save people time and
yeah.
Because I would argue if you're in my office, like the hands-on, the rehab, that kind of stuff is my focus. If we're on telemedicine, like communication is my only focus. Like that's all you can really do on.
Yeah, that's all you got, right?
You know, you kind of have to crush that part.
All right, everybody, we're going to cruise on to question number 3. The title of this article is Predictors of Patient Satisfaction and Survey Participation After Spine Surgery. It's a retrospective study or a review of over 17,000 participants, consecutive spinal patients from a single academic institution. So this is part 1. It's about Press Ganey questionnaires. And it was written by Benjamin Hopkins in the Journal of Neurosurgery in 2019. So this is a pretty recent article. But yes, and it had
it's got a decent population size at just almost 18,000 people.
Yes, and all from the same institution, which is kind of cool too. So they know. I liked that part of this article because they're giving the same patient the same exact thing. So when you kind of have a study that's going across like many different institutions, it's hard to keep everything the same.
Yeah.
All right. Your question is, how are positive satisfaction scores by patients earned? So A, are they earned by the competence of the provider? B, with a positive interaction from the clinical staff? Or C, they're not earned, but lost by the performance deemed less than optimal by the patient?
Interesting. So C is there's no way to improve it, but you certainly can reduce it.
Mm-hmm.
It's like arguing with your wife. Like there's no win. There are only grades of losses, right?
Oh, come on, Josh. That can't be true. And there was
I
something.
didn't get a smile out of Laura or Maria, so I'm like worried now.
The only other male was the one that was like, yeah.
Oh, man. But yeah, so these are in, remember, so these are the Press-Ganey surveys. And interesting on this one, too, that I don't know if it'll help you with the answer, if it's going to make the answer more difficult, but a little information about it was only 10.8% of participants actually filled out the questionnaire.
Yeah.
So.
Interesting.
Wow, right. Maria.
Yeah. And I'm wondering how they measure, how you would measure competence. That's what's in, that's.
All right. Your time is up. So let's go around and see. Okay. I got C's. Okay. So Maria had C, Dwayne had C, Lauren had B, and Josh had C. And your answer is C. Which I thought was actually kind of interesting because you would think that, like, as a patient, you're seeing, okay, like my doctor's doing good. Like that would give him a point. My nurse was really pleasant. I'd give her a point. My staff instruction was great. I'll give them a point. But instead, it's more of like people don't say anything unless there was a problem.
I actually read this study a few years ago because I'm a nerd. But the other thing that I thought was interesting about this, when you said like what percentage of people didn't fill out the survey, I believe, if I remember right, there was a certain time marker. So these are like after spine surgery. These people are in the hospital for like at least a couple days. But I think if you delayed them like 2 days or something, they wouldn't fill out the survey and they'd just be like upset. So it's like, even though they had a major procedure, they were like, I just want to get home. And they kind of got to this point where they're like, I don't care what you're asking me to do. I'm not going to do any of it, you know? Mm-hmm. So yeah, that's the only part I remember about that study.
Yeah, it was interesting in the essentially post-operative, a lot of the studies that I've read that have been like post-operative, it's really like if everything went as it was supposed to be, nobody says anything. But if they had a complication or if they had an issue, then they're like, I'm filling out that survey. So, I mean, patient communication wise, like how can we get them to actually fill out these surveys like before and after so we can actually get a better reading on how well the like performance of the staff is doing would be ideal.
Yeah.
I
would like to see how many of the surveys were just found torn up on the floor by, next to the patient's bed. Like
Maria.
I mean, I just don't know how, I don't really know. I mean, being in nursing for 14 years, I don't really know. I'm not surprised with the 10% that answered because that's usually what it's around anyway. It's like 10 to 15% on average. And looking at the answers, I mean, just even thinking about the number of patients I've dealt with, like, do they care about the competence of the provider? Yes. Do they care about a positive interaction with clinical staff? Yes. Like, they care about all of that. It's not just those two specific things, like one is equal or one is better than the other. It's everything combined. It was interesting the way that they worded, it's not earned, but lost. Because it's true. I mean, they could, like Dr. Josh was just saying, like they could walk away and you were saying, Melanie, like everything was completely fine. They're not going to fill it out. If they had something that was like more than optimal, they might do it because they feel like they want to make a difference. Like they want the provider to have and the staff to, have good reviews and word of mouth too. I mean, I would say like satisfaction scores, yeah, they're important. I know like Press-Ganey, but It's also about the word of mouth too.
What Google review they're going to write.
Yeah. Or who they're going to tell.
Hey, Josh, we can't hear you anymore.
I was cussing a lot, so I didn't want it to be recorded. No, to your point, Maria, I remember that reading something in like some business magazine or something that airport bathrooms were like the number one source of complaints in an airport. It's timeliness of the flights and bathrooms. That's it, right? You can't, but if you're the airport operator, you can't affect the timeliness of flights, right? So they're like, we're going to clean up our bathrooms. And the thing that they realize is you can ask people to text, you can ask them to fill out service. They're not going to do any of it. And so finally what they come up with, and I don't know if you guys ever seen this, where you're leaving a bathroom and there's like a 3-button thing. It's like a smile,
Yeah.
unemotional face and a frown. And they're like, that's the only way. Until we simplified it that far, we could never get enough data to make changes. And so they had to get to a 3 buttons choice. So I wonder, Maria, if you just texted these people and like had like just tap one of the choices on your phone, would that give us better data than the long press gainy, PhD level deep dive?
I think too is something like this. People expect it to go well. It's like by the time you make it to surgery, it's like, well, this is my only option. Surgeons went to a lot of school. It's supposed to go well. But when it doesn't, I'm really angry because I just spent all this time and everything for it. So it's like,
right. And like, what is like competence of the provider? Hey, I woke up after surgery. Great. Like, okay, you win like that. Like, what is competence? Like, they don't know. They can't. Did he do an anterior or
he did the surgery
posterior approach? Like, whatever, man. That was what was supposed to happen.
All right, you guys ready to move on?
Fine, cut off our interesting discussion, Melanie. We were solving healthcare issues here. But yes, we can move on.
Keeping the tray to chugging.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
All right. Question number 4. The article title here is Patient Satisfaction in Academic Pain Management Centers. How do we compare? Just the title there, we kind of get a feeling for where we're going to be. The author here was Joseph Ganella, and it was published in the Current Pain and Headache Reports Journal from 2020. Your question is, true or false, limiting a patient's opioid prescribing led to poor patient satisfaction scores?
Interesting.
So,
but the provider did not prescribe opioids. Was patient satisfaction higher or lower?
Yes.
Oh, man.
So true that limiting opioid prescribing led to poor patient satisfaction, or false? It'll give away the answer, but I'll give you a little bit more about this study in a minute, or I guess in 10 seconds. All right, everybody ready with an answer? Okay, Dwayne says true. Lauren's got true. Everybody's got true. All right, you guys were all correct. It is true, which I found was super interesting because in my head, I'm going, oh, we're trying to help with the whole opioid, oh God, if I can speak today, opioid crisis. In certain states, it's really bad. And you'd think that if we decrease the amount of prescribing that everybody would be happier, but the people that want those pain medicines are not happy.
Yeah. I mean, in our world, it's no different than like activity limitation. Like if you tell a runner like, hey, don't run or cut your running in half for 2 weeks, like they're not excited. They're not thankful.
Yeah.
In my experience.
I think too, this is people who have made it to the point that they're at a pain limit. It's like they're looking for a Hail Mary at this point.
Yeah, that's very true too.
So something interesting about this, just in general, about like the structure of a like larger business, like let it be a clinic, a pain clinic or a hospital, things like that, is you have to deal with the administration, and the administration wants to have happy scores and they want to be, you know, an A-rated facility but so this one said that 83% of practitioners indicated that they received pressure from their administrators to improve the patient satisfaction scores. So they're getting pressure, so they're prescribing more to make people happy, so they, you know, give them a good score. They could tell the administrator, hey, I made people happy. And it's kind of like an endless cycle there.
The other thing too is, I like this kind of Dwayne's point, but this is not the first doctor you saw in the line, right? And so you're being referred to this place. It'd be like telling your kids you're going to go to the ice cream parlor, and you get there and then you're like, we have broccoli. It's better for you. They're like, no, we've been talking all week about ice cream. Like, it's almost that the patient, when they've been referred to pain management, they fill out the forms, they arrive at pain management, they see the pain management doctor. It seems like they did everything correct to get the meds. Now, even if the meds aren't the right thing, but they did their part. And then it's like, yeah, it's a bait and switch. We're not going to give you the thing that you wanted or you expected, or maybe we all sold to you, you know? So no wonder they're so frustrated.
I deal with a lot of, I have 5 active patients right now, and probably all of them, no, 3 of them deal with chronic pain. 1 is pretty severe, and he's not getting what would effectively give him pain management, as far as like the opioids go. And so when this question came up, I was like, I absolutely know that that's true. Because like Josh, you were saying, you know, just because the provider's giving them an opioid, it doesn't mean that it's helping them at all. Because I know from firsthand experience to my patient, it does not help him very much at all. He does stretching that a chiropractor showed him, or physical therapy, one of the two. He did chiropractic care for a very long time while he was working. So he was able to maintain installing spas and hot tubs for over 20 years, which was great. But now, you know, his back's paying for it, and he's not getting the medication that actually helps him, and nobody's prescribing it because of the opioid crisis. And, you know, it's a shame because there are people who unfortunately need opioids to just get through everyday life, to be able to maintain. I mean, my patients are giving up things that they love. Like, in life, you're supposed to be able to go and live it and enjoy the things. And it breaks my heart a little bit more every day that they tell me that they're not able to do the things that they love, or they have to give up because of pain. And it's like, where do we go from here? I mean, there's, you know, it's just, I could go on. I could go on and on and on and on. And I've only been a patient advocate since October, and I can go on.
Yeah.
Well, and if he was getting what he needed from that provider, he'd probably be more satisfied.
Yeah.
Well, and he also feels that that's all that there's nothing else that his provider is doing, right? Mm-hmm. Like, he just feels like, oh, well, he's giving you these meds. Well, that's not what the patient wants. The patient wants, like, you know, Josh, like you were saying, like, or Dwayne, I can't remember, like, pain clinics. Like, this is the kind of person who has that chronic pain that needs that kind of specialty, and he's just not able to get it.
I remember talking to somebody at the VA, and they were saying, like, because they, you know, opioids were prescribed like crazy in the military, and then these guys get out and they're all beat up and whatever. And so they were like, oh, we're going to do what do they call it? Alternative intervention strategy. It's like, you could choose from aquatherapy, massage, acupuncture, meditation, all this. And they said there was like a subset of patients who were like, cool, I want all of it. Like, because that's the only, like, it's not like this little piece of acupuncture is going to replace the effect of, you know, 12 Vicodin tabs a day. It's like, I need all of that, and it's still going to be a struggle to get off the meds, you know, and it's crazy, man. But to your point, Maria, like, you can't just say like, no, like, okay, then what, you know? It's frustrating. That's a frustrating world, man. I'm glad I'm not in pain management.
Difficult, definitely. Let's move on to question 5. It's our last question of this podcast. your article title here is Patient Acceptability of the Use of Advanced Practice Providers, so think ARNP or PA, in an outpatient neurosurgery clinic. This one was written by Cleta Shayu in the Curious Journal of Medical Science from 2020.
Okay, real quick question. How many times do you think the name Cletus is published within research articles? I'm just asking. Feel like it's a low number.
Wait, is that like a bonus? Do we get bonus points if we answer that?
You get 614 bonus points if you answer correctly.
Josh, you don't get to add points to this podcast. I'm hosting this one.
All right.
Your question here, in regards to seeing an advanced practice practitioner versus the neurosurgeon for pre and post-operative visits, this was found to be true. So A, patients were satisfied with seeing an APP as long as they had known beforehand. B, patients would rather wait for the neurosurgeon versus seeing the APP. Or C, patients did not have a preference who they saw at their initial visit and the first post-operative visit.
This, I think, is the best question of this whole trip. Like, this is an interesting question, and I have no strong feelings about any one of the three choices.
Mm-hmm. I know you can think from like personal experience, like, I don't know, like my dermatologist, I've only ever seen the PA and she's extremely knowledgeable. I wouldn't see anybody else because I love her. So, yeah. But that's
also in a lot of offices, you don't know. Like somebody comes in and starts treating you and is very knowledgeable. I don't go, excuse me, real quick. What's your license? Are you a PA or are you the like derm? And you're like, I just want care. That's interesting.
Yeah. Guys got 20 seconds. So
Lauren, have I been cutting you off because it keeps lining up purple like you're going to talk?
No, I'm probably just shuffling around. I was just thinking in my head, like I did coverage work for my previous employer for like a year and a half. And there were definitely patients that would rather wait for their regular chiropractor to be back and like would walk out the door when they saw me. And it wasn't personal. It's just like, they're like, no, like coverage doctors, we don't want to see you. So I'm like, I'm really curious what the answer is here because...
Yeah.
Lauren, I had a very similar experience. I covered for a doc that had hip surgery. And I'm like, he's going to be out for 10 weeks. So you can either see me or nobody. And there were patients that waited until he came back.
The interesting part there is this is saying this study is stepping down in license, right? Going from a neurosurgeon to an advanced practice like a PA or something. But for you guys, you had perfect parity of license, right? It was going from DC to DC.
I wonder if ECs, I feel like there's more of a relationship between the patients than there would be with neurosurgeon.
Yeah.
It's more, intimate, definitely. All right, you guys ready? Let's see those answers. Okay, Dwayne with an A. We got Lauren with an A. Josh got C and Maria B. And your answer is A. So in the neurosurgery, so there were 78 people. So now this wasn't a huge pool to choose from, but there were 78 adult patients that were interviewed at this neurosurgeon practice. And patients were satisfied seeing the advanced, practice practitioner as long as they knew beforehand. So people were much happier if they were like, hey, the doctor's he's not available during that time, but you'll be seeing, the ARNP or the PA. And most people were fine with it.
I've met a few neurosurgeons, and I would like the fourth question to be, would you rather, after seeing the neurosurgeon, would you rather have your pre and post-ops with the advanced practice practitioner who has a much more cordial demeanor? I had a patient tell me he had surgery by a doctor I'd recommended, and I said, how'd it go? And he said, the best part about my surgery with him is that I was under general anesthesia for most of my time with that gentleman.
Yes.
I thought, ouch, what a good description.
I think you get this. We're in a small town and the urgent care, like right across the street. Every single patient that I've seen from there or every single review that they have is for the nurse practitioner. They all like absolutely love her. And I've never heard or seen anything about the actual physician that's there. It's like, it's kind of interesting, but everybody loves her. Never really hear anything about the sitting doctor.
Interesting. Hey, Dwayne, did you know you won again today?
Okay.
I think Dwayne's got at least 2 under his belt. Dwayne, do you know what organization you'd like your donation to go to?
We can just do ACA.
Okay. ACA.
For those listeners that might not know, that is the American Chiropractic Association.
That's right.
Yeah.
Wait, Melanie, does this mean that you have to have me back again so that I can like duke it out with Dwayne?
Yes.
Do like a
That's
Yeah.
exactly how this goes.
like the reigning champ needs to like I'm like the second runner up.
Yep. Yep. We had you. You guys were close by 1 point. So, everyone, I'm going to wrap it up. And I'd like to thank our guests for another entertaining episode being here with us today. And also thank you to all the listeners that enjoyed another learning journey with us. Come back and join us again next week as we discuss more stimulating medical communication research.
Thanks for tuning in to this episode of Trust Driven Trivia, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Join us next week for more laughs, new guests, and fresh questions that turn medical research into pure fun. Trust Driven Trivia, making healthcare knowledge exciting, one question at a time.